Hi guys, it's Stacy from Clothes Live On, and today I want to talk about something that got asked a lot at Posh Fest to me, and that is, what do I do for health insurance? I probably have a different answer than a lot of other full-time resellers who tend to be on their spouse's insurance from a regular 9-to-5 type of job. I don't currently have that. That will actually be my situation starting late next summer. I am going to be going on to my husband's health insurance offered by his job, but right now I am on independent health insurance. So if you are kind of thinking about going full-time and you want to know how to get health insurance, this is the way that I do it. So I am actually on the Marketplace health insurance. It was previously kind of known as Obamacare. It's always been Marketplace health insurance though. If you log on to healthcare.gov, you can sign up for independent health insurance depending on your job situation, which if you are self-employed, you definitely will qualify. I have been on the Marketplace insurance since actually 2014 when I was a nanny, since that's not a typical job with the regular benefits that you would expect. I was on Marketplace insurance with that too, so I've been very familiar with it since I've been on it for so long. So how that works, there's an open enrollment period for anyone who's interested in Marketplace insurance, and that is November 1st to December 15th. So we're getting really close as of when I'm filming this video to that cutoff period. So that's every year, that's when open enrollment is. And that coverage, if you sign up during open enrollment, will start January 1st of the following year. So if you are interested in getting some Marketplace insurance, now is the time to sign up, at least for when I am filming this. So you can pick through different insurance plans. You are going to have to fill out a long application form. It's going to want a lot of your info, background info, your income info, things like your spouse's income. There are different levels you can pick to potentially get a reduced health insurance, but then you could pay more taxes on it later if you didn't actually qualify for that reduction, but you thought you did. It's a whole thing. I'm not a tax expert. I wouldn't even say I'm an expert in this. I just use this insurance. So of course you can always reach out to someone who is more of a professional if you have any further questions. But if you do have any questions that I can answer, I will answer them in the comments down below. So you fill out that form. Like I said, it's pretty long. It's going to ask a lot of your income and health history, things like that, if you have dependents, all that sort of stuff. And then at the end, you will get to pick your plan. The plans vary a lot, and I am obviously picking Illinois-based plans right now. So for me, I will say that my insurance is around, I want to say it's around the $300 mark, and then I'm paying about $20 additional for dental insurance, because on the Marketplace, dental and health are separate plans. So you can optionally only sign up for health insurance. I don't think you can get dental without getting health insurance, but you can get health insurance without getting dental. So it's up to you. I pick both so that I can still go to the dentist and all that and get some clean teeth. So yeah, for me, it is, probably around the $320 range for both of those insurances, and that is a monthly thing that I pay. So it is expensive. I actually want to say I don't think that's untypical for jobs. It's just a lot of times it comes out of your paycheck and you don't notice that you're paying that kind of premium, but also sometimes your job will pay a part of that, so you actually might be paying less out of your pocket. The coverage that you can get through the Marketplace varies. You can pick a cheaper plan than what I have, and have less coverage, have a higher deductible, less out of pocket monthly. But if you don't use your health insurance very often, that might be a plan that you are interested in. For me, I really wanted a PPO. Most of the Marketplace insurance plans are HMOs, which limits the doctors that you are allowed to see. I'm still limited, obviously, to places that accept my insurance, but I get a lot more flexibility in picking who I see, which was something that I was personally interested in, so I was willing to pay a little more for that. And I don't like paying a super high copay when I see the doctor, so that was another big factor for me. And then when I picked my dental insurance, it was a big factor for me for cavities, how much they'll cover for that, because genetically, I just get a lot of cavities. It doesn't matter how good I am with brushing and flossing and all of that. or eating sugar or not eating sugar, I get lots of cavities. So for me, it's important to pick a plan where my insurance will cover at least half of my cavity filling stuff, if not more. Some insurances make you totally out of pocket that. So when you're looking at your plans, you will know your own needs the best. So pick whatever works for you. That's just what was working for me, was those requirements. But yeah, like I said, if you are in the need for health insurance, healthcare.gov, and then you get marketplace insurance. If you have a job change during the year, you can also get sign up for the health insurance without it being open enrollments. So if you lose a job or switch careers or any of that, then you are also allowed to sign up for the marketplace. But I do think they sometimes ask for proof of it, so they might contact your previous employer kind of thing to make sure you actually had a change in your job. Initially, when I got on the marketplace insurance, I actually started it, I want to say in September instead of a January start date, and that was because I had just started a new job. So I was allowed to enroll not in the open enrollment period. So there are exceptions to that if you're ever curious, and that has a lot to do with job change situation. But yeah, that's just what I do for health insurance. It's a little expensive, but having insurance is, I think, legally required, but also just, you know, in life necessary. I have a really bad immune system. I get sick a lot. Much less now than when I worked in childcare, but still enough that I like the peace of mind of having health insurance. And then obviously dental, I get a lot of cavities. I want to be able to get my like regular twice a year cleaning and all of that. So that's what I do for health insurance. If you guys have any questions that you think I can answer, you can obviously comment down below. But I would say it's probably a little easier to find a contact form on healthcare.gov if you have any very specific questions, because I'm not an expert in this sort of thing. It's just what I use, and I wanted to let you guys know because I think that is one of the most commonly asked questions is, what do you do for health insurance? If you guys did like this video though, please give it a thumbs up. And of course, if you aren't subscribed to my channel, click the red link down below. Thank you guys so much for watching, and I will talk to you later. Bye!